Good morning.
How's everybody today?
How are you doing, Dr.
Oh,
Gruttadauria?
I'm outstanding. How about
It's
you?
been a long time since our last conversation.
Indeed.
Except our outfits are the same. It's going to give us away.
Right. Well, we wore the same stuff today. Today we're actually going to talk about migraine headaches.
Yeah, migraine is an incredibly debilitating condition, and humans who come to us to ask for help with this, it's always, I think, really impressive just the amount of suffering and how people live with chronic pain and still function with it. But of course it leads to a hugely decreased quality of life, I would say, lost work days, huge burden.
Oh my God, it really, I mean, you hit on something really powerful. People with migraine somehow deal with it, you know? I mean, once in a while, I mean, I'm very lucky not to have headaches, but if I got a headache, it's almost like, wow, I really can't function right now with a headache. Forget about a migraine headache, but people live with these things constantly, and I mean, the statistics are horrible, the number of people that actually have them, and then the number of days that they experience them per month. But we know that migraine headaches are not, you know, due to a Tylenol deficiency. Something's wrong, you know? So a migraine headache is really like a brain attack. That something is going on physiologically that's affecting their brain. So I thought it would be really interesting to see when a migraine patient comes in to see you, what is your first thought?
That's a great question. You only ask great questions. So when I see migraine, I think about, I guess I think closely to what you just verbalized, the brain being under attack. As a functional medicine doctor who knows root cause processes, I think into a deeper mechanistic layer, which is the functioning of the mitochondria. Now, mitochondria, if some of you may have encountered this term in high school biology, but mitochondria is the powerhouse of the cell. We are multicellular organisms, are able to be multicellular organisms because of the mitochondria, and how mitochondria have evolved to be incorporated in our body is a hugely fascinating story. And maybe we can nerd out on that another day.
I absolutely want to have an entire conversation just about the mitochondria. Yes, but we'll hold it. We'll hold it for that.
I'll hold back a little bit. But what's interesting about the mitochondria is that they are the source for energy, and an average cell will have about 200 mitochondria. The nervous system is incredibly rich in mitochondria. Mitochondria are generating the energy for our metabolism. That's a giant statement that I can't overemphasize. The sum total of our ability to function, create energy for whatever it is that every cell is doing, which is a gazillion things every second, it's really truly mind-boggling, is generated, the engine of that is the mitochondria. And the average number of mitochondria in a nerve cell is 2,000 versus the 200 in the other cells of the body.
What's cool is I read a statistic that they said if they were able to capture all the energy and all the mitochondria, we are walking around with a bolt of lightning inside of us right now. It's like amazing what it does. So when you have a mitochondrial dysfunction,
it will manifest first in the nervous system because the nervous system is more sensitive to mitochondrial injury. Now what that means, what mitochondrial injury means, I think we can talk about a little more. But I think of migraines, and it's not just I think, these are facts, that mitochondrial function and brain and nervous system health are tightly linked. So when you have the brain under attack, as you call it, that is a mitochondrial dysfunction. And so my job is to examine what the mitochondrial injury is coming from. Is it an environmental burden or toxin, is I think a more appropriate word, that's hurting the mitochondria? Is it that the mitochondria are undernourished and there is a problem in the gut and the body is not incorporating the building blocks it needs to nourish the mitochondria? Is there a problem with oxygenation and blood flow, because mitochondria are also fueled by oxygen, and I think that also taps into blood flow and mechanical integrity of the body and blood flow. And chances are that it's all of the above, and some pieces of the puzzle may be playing a greater or lesser role. But it's our job to examine all of those pieces to actually, again, right, functional medicine, get at the root cause of the migraine syndrome. It's a spectrum. How about you? What would you would you echo or add to what I just
first
said?
of all, I agree 100%. I think that, and the beauty of these conversations is to help people who watch these understand how we can be on the same page, but because of our training, we've actually been trained to look at things a little differently. And that's like the beauty of the relationship. What I always do is I try to break it down into a biochemical perspective, a neurological perspective, and a structural perspective. And because we know that, for instance, a problem in the neck can create headaches. We know that a problem in the biochemistry can create headaches, and we know that neurological dysfunction can create headaches. So we want to try to break it down and look at all three things. Like I think many patients that I've seen over the years that have migraine, a question that I always ask that sometimes really is kind of fluffed over is, have you ever had a head injury? And even a minor head injury can create a change in the dynamics of the brain and cause problems, down the road. So I have a patient that I'm working with now who has, a significant balance disorder. And, when I questioned them about head trauma, they said, no, I've never had, my son's never had a head injury. But then the son said, well, don't you remember that time? And all of a sudden, they were able to say, wow, we didn't even realize that, this was a head injury because they didn't become unconscious. So people kind of never.
What was it? Or is it too specific?
No, it was a bicycle accident. And this kid went and flew over the handlebars and cracked his head, but did not become unconscious. So because I think that we as parents a lot of times will say, oh, okay, they're okay, and then forget about it.
Brush it over.
But what happens is that trauma really can make a significant change in the dynamic of the brain going forward. And not everybody heals 100%. So when you have then tiny modifications in the brain function, that can lead to dysfunction down the road. So you can end up with dizziness or headache or even anxiety, depression, all these things. And so many of them are related to head trauma. So I think all of these things need to be looked at. One of the big pieces that we look at is eye movements and balance system, because both of them are very powerful windows into brain function.
How do you do that?
Physical exam, so we do a functional neurological exam and we look at the three main eye movements. They're called pursuit, saccades, and vergence, and we look at qualifying and quantifying exactly how they're working. So, for instance, if my eyes are having a hard time moving to the left, it puts strain on my brain to try to do that during my daily routine. So I don't even think about it, but if I'm driving and somebody's going that way and my eyes have to move in that direction, it causes extra strain on my brain to try to handle that motion. And if that's happening thousands of times every day, then of course there's going to be a drain on brain functionality. And then that goes back to mitochondria and and all these things.
Because you need a tremendous amount of energy to fuel that, and if your body's running on empty, you have that challenge in terms of brain function. Plus, you're going to have a metabolic deficiency.
There's so many pieces. I mean, the brain has two pacemakers. We know that the heart has a pacemaker that handles the rate and rhythm of the heart, but the brain's got two. One of them is driven by movement, which is what we call thalamocortical oscillations, and the other one's driven by light.
Thalamocortical oscillations, say that 5 times fast.
All right. And then the other one's driven by light, and that's the suprachiasmatic nucleus in the hypothalamus.
We are having major issues with the light engine of our brains because of all the artificial light and blue light we're being exposed to.
Mm-hmm. So when you look at this, I mean, it becomes an enormous consultation with the patient because we really need to get to know who they are, then physical exam, then lab work. So I mean, the extent of what we're doing.
And it may be obscure history that you may not have thought is playing a part in the constellation of your symptoms, but actually is.
Right. So when somebody comes in and they say they have migraines, we don't then turn around and say, yes, you have migraines. We know you have migraine, I know you have migraine, but now we want to know why you have migraines. And then once we can get the story and we can try to put those pieces together, then we're in a much better position to rehabilitate that brain and help them actually move past the migraines.
It sounds really complicated, so I want to know what the timeline can be.
Well, I always tell a patient it's going to take half as long to get better as it took for you to have this. So they say, well, I've had this for 10 years, so I say, it'll only take 5 years to get better. But I'm only joking, obviously. Everybody's so different. When you have a brain, syndrome like a migraine, we don't really know how it's going to respond. Sometimes people feel better literally in a week. I have a young lady who had really, really bad migraine. She's a gymnast, competitive gymnast. She had 2 falls on her head, post-concussive syndrome, migraine, and within a week of doing these gaze stabilization exercises that we started her on and elimination diet, she was already feeling like significantly better as far as the intensity of the migraine. So everybody is different as far as their response to therapy.
Right, because the root cause processes are different. I think what's exciting about our center is that we have some tools to sometimes catalyze or speed up the healing process. One of the tools that we've had a lot of success with is restoring one of the main ingredients of the brain, right? It's phosphatidylcholine that makes up all of the cell membranes, including nervous systems. And so when we nourish the brain, especially if there's oftentimes we'll see with brain syndromes, right, and chronic neurological decompensation or inflammation, if that's a better way of kind of categorizing or putting migraines under that umbrella, we can, with a few relatively quick IV treatments, we can see how much the metabolic process is playing a role and bypass the gut and give a few injections IV. And oftentimes, even if we're not curing migraine that way, we're alleviating suffering. And so the notion that better is possible can actually be achieved rather quickly, even though, as we said, if we're really doing the work of healing, it's not superficial. Our model is certainly not a pill for an ill. However,
we don't want people to have to suffer through the whole process.
Right.
We can give them relief right now. And some of these IVs are so powerful, even like magnesium, for instance. Magnesium is a very, very strong mineral in that it reduces NMDA receptor activation. So when the brain is hyperactive and this migraine syndrome comes on, we can actually help gate the overactivity or the hyperactivity with magnesium.
What is an NMDA receptor?
NMDA receptor is the main receptor in the neuron that allows for activation of the nerve cell. So when we have, if you could imagine, these different chemicals, flowing in and out of the nerve, that's what creates the electrical activation. So magnesium is almost like a plug. So magnesium can come in and actually reduce, this hyperactivity in the brain.
Hyperactivation of the brain, and
that's
calm the nervous system down.
Right. And then how often do we see magnesium very, very low in patients that we test?
Like every time we test blood work,
So,
even when we're replacing it, because the body just needs it, and the body under stress has a higher physiological need for magnesium.
And then we have the patients take small steps like using blue blocking glasses when they're using technology and indoor lights and so on. But I mean the breadth and depth of what we're doing for a migraine patient is so far beyond what anybody else is doing that we have a much better chance of actually helping them resolve this problem permanently.
And we've seen remarkable situations where people come in, sometimes actually, the migraine story, I've had one scenario at least that stands out in my mind. The migraine story was an aside. There was another primary concern, and migraine had been so chronic that this wonderful, wonderful human being had lost all hope of addressing migraine, actually. And then kind of at the end of the consultation said, and as an aside, I've had migraines daily for the past 50 years.
Oh my
and
God.
if that could be improved upon, that would be a bonus. And lives for now for months at a time, migraine free, which is as miraculous for her as it is for us.
Right. I mean, it really is. It's a great feeling when you help
really-
somebody like that.
Stay really humble and just go piece after piece, and really applaud the courage of people who still hope that better is possible and come here and give us a try and give functional medicine a try.
Absolutely. All right. Well, this was wonderful. Thank you very much.
Thank you so much.
Have a great day.